Well, hey everybody, this is Robert and welcome to Outbreak News TV. And what we're going to do today is a end of the week show, the Outbreak News This Week in Review. And I'm going to be taking a look at some of the stories that I found most interesting or most important. You may see some of these stories not in the same light I do, and maybe you think there's ones I missed. But this is my own compilation of the news of the week that I thought was pretty important. And before we get started, I want to just remind you to, if you like what I'm doing here, to subscribe to the channel, like the video, comment below, and share it with your friends. That'd be highly appreciated. Let me go ahead and get started with Cambodia reports the 13th human H5N1 avian influenza case of the year. And the Cambodia Ministry of Health reported an additional case of H5N1 avian influenza. This was in a 6-year-old boy. And excuse my pronunciation, but it's Damong Khmum province in Cambodia. I probably put that, but understand. Child presented cough, fever, diarrhea, vomiting, and shortness of breath. And according to the health ministry, the patient's currently undergoing medical care in the intensive care unit. Investigations revealed that during July, there was a series of sick and dying chickens in the village, and the boy visited a relative's house where there were nearly 100 dead chickens about 100 meters away from the child's house. And one of the dead chickens was taken to the grandmother to cook. So yeah, it's pretty easy epidemiology going on right there, right? This is the 13th human case reported in Cambodia in 2025 to date. Now, since the World Health Organization started monitoring this stuff around 2003, there's been 988 human cases of avian influenza A H5N1. About half of them have resulted in death, and they've been reported from 25 different countries. Nearly all the cases have been linked to close contact with infected live or dead birds or contaminated environments. From 2003 to present, 85 of these cases were reported in Cambodia, with about 6 out of 10 people dying from the virus. Let's move on to a story that popped up, I think it was on Thursday, and that's in Timor-Leste. They were certified malaria-free by the World Health Organization. Now, Timor-Leste, or it's also known as East Timor, is a country in Southeast Asia. It's part of one of the islands. This past week, a landmark public health achievement was announced about the country by the World Health Organization. They were certified as malaria-free. So with this announcement, now there's been a total of 47 countries and 1 territory who have been certified as malaria-free by the World Health Organization. Timor-Leste is the 3rd country in the Southeast Asia region of the World Health Organization, joining Maldives in 2015 and Sri Lanka in 2016. And this also marks Timor-Leste's second disease elimination in under 2 years. In 2024, lymphatic filariasis was declared certified free in the country. So congratulations to that country, Timor-Leste, and it's a pretty young country too. So good things happening there as far as disease prevention and elimination. The next story I wanted to touch on was here in the United States, and And then South Carolina in the U.S., the first cases of Eastern equine encephalitis were confirmed in 2 horses. And these 2 horses died, according to state officials. According to Clemson University's Department of Livestock Poultry Health, a 5-year-old unvaccinated stallion in Jasper County succumbed to the disease, while a 5-year-old mare in Aiken County, whose vaccination status was unknown, was euthanized after exhibiting neurological symptoms. The National Veterinary Services Laboratories confirmed both diagnoses on Thursday. Now, Eastern equine encephalitis, aka triple E, is a mosquito-borne virus with a high mortality rate, about 90% in unvaccinated horses. And these recent cases serve as a critical reminder to equine owners across the state to remain vigilant during peak mosquito season. Now, vaccination is essential. South Carolina State Veterinarian Michael Newalt strongly urged horse owners to consult with their veterinarians to ensure vaccinations are up to date, not only for triple E, but also for West Nile virus and for rabies. Quote, as is always the case with South Carolina summers, we have had a lot of rain and warm temperatures, which means that mosquito populations can be extremely high. It is always important for horse owners to stay on top of the equine vaccination schedules, but it is particularly critical in the summer months, close quote. Now, while South Carolina has historically maintained lower case counts compared to neighboring states, for example, here in Florida, largely due to vaccination compliance, the risk remains elevated through late summer and early fall. So that's some information coming out of Clemson University in South Carolina. The next story comes out of Minnesota, and officials in Minnesota are reporting an increase in tularemia cases so far in 2025, both in humans and companion animals, particularly cats. And this is across the state, including the Twin Cities area, according to the DOH there. According to the Minnesota Department of Health, or the MDH, 5 human cases of tularemia have been identified in 2025 so far. 2 people developed tularemia after being bitten by a tick, 1 after being bitten by a stray cat, and 1 was likely exposed while mowing the lawn. So if you're out there mowing the lawn and you run over, say, a dead rabbit or something, you will be exposed to the tularemia bacterium. They're currently investigating the potential exposure of the 5th case, so that is yet to be confirmed. Every year, they report about up to 6 human tularemia cases in Minnesota. People most commonly develop tularemia from tick and fly bites, bites and scratches from infected pet cats, or by touching animals who have the disease. People have also been exposed by breathing in bacteria if they accidentally mow over a dead animal or a contaminated rabbit nest. This is not a disease that is spread person to person. Tularemia is a potentially serious illness of animals and people that occurs naturally in Minnesota, they say. It is caused by the bacterium Francisella tularensis, which can be found in wildlife, in particular in rabbits, squirrels, beavers, muskrats, and other rodents. Now, pets are most often exposed to tularemia by hunting these animals, but can be exposed through tick or fly bites also. Although many animals can be affected by tularemia, cats that spend time outdoors are at the increased risk. Now, the types of illness that you may see in an animal that has tularemia would include a high fever, weakness, a lack of appetite, skin or mouth ulcers, and swollen lymph nodes. Now, the senior epidemiologist in zoonotic disease unit at the MDH, her name is Maria Bai. She said it's important for pet owners to be aware of this disease in their pets because it is possible for a person to become infected as well. All forms of tularemia in humans are accompanied by a sudden onset of fever. You may also see skin wounds, ulcers, swollen lymph nodes, headache, chill, joint and muscle pain, and nausea. These symptoms usually appear about 3 to 5 days after exposure, but it can be as soon as the next day or up to 2 weeks after exposure. So we're going to be keeping here at the website outbreaknewstoday.substack.com. We'll be keeping a close eye on any additional news coming out of Minnesota concerning tularemia. Now let's go about halfway across the Pacific Ocean to the state of Hawaii. And the Hawaii Department of Health has recently issued heightened warnings to tourists and residents, advising them to avoid consuming raw or undercooked food. And this is due to a parasitic infection called, the disease is neuroangiostrongyliasis. Many of you may know of it as rat lungworm disease, and it's endemic throughout the islands of Hawaii. People become infected with the parasite, it's Angiostrongylis cantonensis, if they eat, whether intentionally, sometimes people do stupid things with dares, or otherwise, a raw or undercooked infected intermediate host, which is typically a snail or a slug, thereby ingesting the parasite. So a lot of times people may get it, like I said, by taking a dare or not thoroughly washing their vegetables or lettuce or kale or whatever, and getting even the tiniest of snails, off of it. A new medical advisory was released by the Hawaii Department of Health on July 15th, and that emphasized heightened clinician vigilance due to nonspecific early symptoms that can evolve into debilitating conditions over weeks. Now, last year there was 7 laboratory confirmed cases in Hawaii, and so far in 2025, there's been 1 case, and that was in Maui County. The DOH writes that experts caution that the actual disease burden is likely higher due to diagnostic challenges. As an example, a visitor contracted the disease in late 2024 after consuming unwashed greens during a hike on the Big Island, and that's resulted in a prolonged hospitalization. Dr. Lauren Pang, an epidemiologist with the Hawaii DOH, says this is not just a local issue. Visitors are at equal risk statewide. And the parasite does not discriminate. She goes on to say it's statewide. So simple precautions like washing your produce, avoiding raw snails or slugs can prevent a vacation from turning into a nightmare. Pang closed with. So if you're going to Hawaii, watch out for the snails and slugs. The next story, and this is one on the website we're really keeping a very close eye on, and we're seeing that Chikungunya is really starting to skyrocket in one of the southern provinces, Guangdong province. And the health officials in that province report that since the beginning of the month, a total of 3,645 confirmed cases of locally acquired chikungunya have been reported in Foshan as of July 24. And I think the first time I reported on it, and more like in the middle of the month, there was about 480 cases. So yeah, it's rising pretty quickly. The outbreak was initially triggered by imported infections. Most of the cases, over 3,300, were in Shunde district, and then there's lesser cases in several other districts in Guangdong province in southern China. All the cases were mild, with no severe or fatal cases so far, so that's good news. And you'll also notice that places that are close to this province in southern China, in particular Macau and Hong Kong, are really keeping a close eye on this. And here at the website and at the YouTube channel, we'll be also keeping a close eye because these are high population centers. All right. Next, I just want to remind everybody that I did a couple podcasts during the past week, and then I want to encourage you to check them out. I will link to them below. They were both with guests from the African continent, and the first one was about Senegal eliminating trachoma, the blinding disease, bacterial disease. And I interviewed Dr. Caleb Mcfat. He's from Sight Savers. And the other interview was with Marcel Ishimwe. And this is a young man that started an organization last year called AMR Initiative Rwanda. And it's concerning antimicrobial resistance and preventing that. So I encourage you to check those out, and I will link below if you want to check out those podcasts, those interviews. Let me move on to the next outbreak that I'm keeping an eye on now, and that's in Ho Chi Minh City, Vietnam. And it reported over 15,500 dengue cases so far this year in the city since the beginning of the year. And this is a 158% increase compared to the same period last year in Ho Chi Minh City. There's been 10 fatalities so far. Cases are really rising in that part of Vietnam. And it's also causing problems with the healthcare facilities. And here's a report from Vietnam News that Ho Chi Minh City has increased support for lower level hospitals, especially in An Phu ward, where 2 hospitals have recorded many severe cases and they're at the risk of patient overload. The Van Phuc 2 General Hospital and An Phu General Hospital are 2 private facilities that have recorded an increase in the number of dengue fever cases admitted in the past 3 weeks, facing the risk of inpatient overload. So we'll be keeping a close eye on this and see how they handle the increase in cases and the hospital situation of patient overload. The next story is back again closer to home, again in South Carolina, and there was earlier this week there was a reported case of the brain-eating amoeba, Naegleria fowleri. The South Carolina Department of Health reported the confirmation of a Naegleria fowleri case, and this was a statement that was reported earlier in the week. Quote, the South Carolina Department of Health was made aware of 1 case of Naegleria fowleri in our state the week of July 7. Naegleria fowleri is not required to be reported to the Department of Health. The agency does not track infections from the amoeba and does not provide information about or comment on individual cases, including the person's condition. Recreational water users should assume that Naegleria fowleri is present in warm, fresh water. However, the risk of infection is very low. There are less than 10 cases annually in the U.S. While rare, Naegleria fowleri is nearly always fatal. And since that statement, there has the child it was a 12-year-old boy, has been identified. It appears he had contact with Lake Murray, and the name is out there too. And there's actually a GoFundMe page, and I'll link to that in the show notes if you want to help out the family with this tragedy in their family. For some people that may not be familiar with this parasite, let me just talk about it just a little bit. It's a microscopic amoeba, and it's a single-celled living organism. All right. It causes a rare and devastating infection of the brain called primary amoebic meningoencephalitis, or PAM. The amoeba is commonly found in warm, fresh water such as lakes, rivers, ponds, and canals. Now, the infections can happen when contaminated water enters the body through the nose. So you're not going to get it by ingesting it. Now, once the amoeba enters the nose, it travels to the brain where it causes PAM, which destroys the brain tissue and is 97-98% fatal. It's very, very high. Infections usually occur when it is hot for prolonged periods of time, which result in higher water temperatures and lower water levels. Infections are rare. Most infections occur from exposure to contaminated recreational water, like swimming in a lake or diving in a lake or falling off water skis or something like that. But there's also been, cases reported from the use of neti pots using tap water, or in some countries, particularly Muslim countries that practice ablution, we see cases like that. You look at Pakistan, we see a lot of cases in Pakistan due to that practice. And I guess, like I said, you can't get it from contaminated water, as far as drinking it. And it's not really found in salt water. So this is a freshwater parasite. The initial symptoms of PAM usually start within 1 to 7 days after infection. The initial symptoms may include headache, fever, nausea, or vomiting. Other symptoms can include a stiff neck, confusion, loss of balance, seizures, and hallucinations. Typically, after the start of symptoms, the disease progresses pretty rapidly, and then the treatment, there's not any really good specific treatment for this. So treatment is frequently unsuccessful, and it has to be really early in the earliest stages of disease to get this stuff started. So let me see where I lost my page. Give me 1 second. Okay, since the 1960s, only 167 people have died from the amoeba in the U.S. I didn't say only, but yeah. So it's rare, but it is very lethal. I think there was one survivor several decades ago, and then since 2013, there's been 4 or 5 survivors. I don't exactly remember, and that was after the introduction of this one drug, miltefosine, but still, fatalities still happen, and unfortunately, this 12-year-old boy did die from it. Let me go to the next story, and we're going to go across the Pacific to Japan. And in the U.S., we're seeing a very high number of pertussis cases, or whooping cough cases, this year. And it's over 15,000 cases so far. However, in Japan, the whooping cough cases are soaring. So far, there's been about 44,000 cases this year. This is more than a 10-fold increase of the about 4,000 cases reported in all of 2024. Preliminary data from the Japan Institute for Health Security also showed that the number of cases reported by hospitals and clinics across the country reached a new weekly record. So the this is the week through July 6th. This is the most recent numbers. It was 3,578 cases in Japan, and this is the highest number ever in the country since the current survey method has been employed, and that's 2018. So yeah, keeping a close eye on Japan because they are getting hit really hard with whooping cough. Next thing I want to talk about, and this is something that I covered exclusively on Outbreak News today, was we got a malaria outbreak going on in Zimbabwe in Southern Africa. And since the beginning of the year through July 6th, there's been 126,229 confirmed malaria cases across the country. This is about a 300% increase compared to the same period in 2024 when there was almost 32,000 cases. So that's a huge difference. Concerning malaria deaths, there's so far 358 reported so far, which is a 500% increase compared to the same period in 2024, which was 59. So yeah, malaria is really hitting Zimbabwe very hard right now. And it's not only in Zimbabwe, but according to the Africa CDC, other countries in Southern Africa, like Botswana and Namibia, they're also seeing big increases in malaria. Dr. Memory Mapfumo, epidemiologist at the Africa CDC, said the surge is no coincidence. Prolonged rains have fueled mosquito breeding, while activities like gold panning, fishing, and artisanal mining are exposing more individuals to risk, especially during peak mosquito activity hours. A contributing factor is the interconnectedness of the countries too, which drives the transmission. So on the website, I have been keeping a close eye on Namibia, and now I'm going to start watching Zimbabwe, and we'll see if any of the interventions they take helps out during this difficult malaria season. The next story I want to look at is Crimean Congo hemorrhagic fever in Iraq. And according to CCHF News, I frequently use them because I have a hard time finding information from their Ministry of Health. CCHF News is good, and right now they're saying that Iraq has confirmed so far this year 226 cases of Crimean Congo hemorrhagic fever and 33 fatalities. Now, according to the news tracker and the data released by the MOH that they got, the highest number of infections are recorded in Dakar province, and that's 84 cases. And Baghdad is reporting the most fatalities so far, and that's 6 confirmed deaths. The health ministry spokesman, his name is Saif al-Badar, advised the public to take strict precautions, including purchasing meat only from authorized outlets, maintaining hygiene, wearing gloves, and thoroughly cooking the meat, etc. These measures, he said, are vital to curbing the spread of the virus, which continues to pose a serious threat in several parts of the country. Next, I want to look at is measles in Bolivia. And again, this is another story I've been watching on the website. And so far, there's been 161 confirmed cases in the country. Santa Cruz remains the epicenter of the outbreak with 136 cases, about almost 85% of the total. But there's been a smattering of cases in several other provinces. The Vice Minister of Promotion, Epidemiological Surveillance, and Traditional Medicine, his name is Max Enriquez, explained that coordinated efforts are being carried out across the 3 levels of government. The national government is guaranteeing vaccines and supplies. while the securities and development centers and municipalities are providing healthcare personnel, mobile brigades, and logistical support, we are also deploying our special rapid action brigades to reinforce on-the-ground operations. Now, one of the focal points, and we're seeing this in Mexico, we saw that in Texas, is the Mennonite communities, where nearly 50% of the cases in Santa Cruz are concentrated. In coordination with local authorities, specific interventions are being planned, including epidemiological lockdowns and mass vaccinations. In addition, efforts are being made to disseminate information in these communities which face difficulties in accessing media. The official stated, quote, "We are responding to the request to organize health fairs to build trust and promote the service offered by the public health system." So yeah, if you want to keep up to date on what's going on in Bolivia, watch or visit the website outbreaknewstoday.substack.com. And I want to go ahead and close out with just a little blurb about what's going on in France and arboviruses, and some new numbers came out. And on July 22nd, this past week, 15 additional cases of indigenous arbovirus transmission was reported in mainland France, 12 more chikungunya cases, and 3 more dengue. And this just brings the total to 42 local arbovirus cases. And this includes 38 locally transmitted chikungunya and 4 dengue. So again, this is a story that we'll be keeping an eye on and see if it spreads further. You can see on the map, where some of these cases are. So it's not all concentrated in one area. We do see them in different areas of the country. So anyway, again, I appreciate you watching. Subscribe to the channel, like the video, etc. And I'll see you next time on Outbreak News TV.